All right. Thank you so much for joining us today at our 8th annual Symposium on Children. Thank you for joining this breakout session, which is about building bridges, not blocks, creating pathways for listening and responding to families and communities. My name is Jamie O'Leary. I'm the Associate Director of Policy and Strategic Communications at the Crane and Schoenbaum Family Centers. And I am delighted to have with us here today, Dr. Sherri Killins Stewart. Hi, Sherri. We have my colleague Delaney will be in the chat box and managing some housekeeping items. We look forward to your questions at the end of the session. So definitely engage, weigh in there. We have a chat as well as a Q&A to post your questions for later. And without further ado, I'm going to do a quick intro of Dr. Killins Stewart, so you know a little bit about her before she presents. She is the Director of State Systems Alignment and Integration, as well as the Co-Director of State Services at the BUILD Initiative. The BUILD Initiative is a national organization that partners with state leaders to promote equitable, high-quality child and family serving systems. The goal of their work is to see that young children from prenatal up to school age, typically age 5, are thriving and learning. And in her role, she's able to do that by working directly with state leaders to advance early childhood systems efforts in early learning, in health, family support, as well as economic and food security. She also leads work around intentional practices to promote equity. As part of this, she co-leads a network of early childhood leaders to advance racial equity. And she works across multiple systems and organizations such as public health, housing, libraries, museums, etc., using a child development lens in this work. So as you can see, she has a ton of expertise, very pertinent for our topic today on family engagement. And I will turn it right over to her and be back for the Q&A. Welcome, Dr. Sherri Killins Stewart.
Thank you so much, Jamie, for having me. Really appreciate the opportunity to be back in Ohio. While we can't be there face to face, I'm happy to be participating this way with you. Jamie mentioned in the intro that I work with the BUILD Initiative, and it really works to tailor timely technical assistance to state leaders across the country. We really do try to support state agencies to work together across programs, across disciplines, across sectors such as health and early learning, housing, economic and employment services to support families. And I think after the talk this morning about the intersectionality of these issues, that is quite relevant to support leaders to do that. So thanks all of you for joining. What I want to do today is offer a framework for a set of actions that really advance equity for children and families, give you some practical steps for creating feedback loops with families and communities, and also help you consider how family voice can impact policy, practice, and programs. We will talk about why family engagement and voice is important. I'll offer you a framework, the way I think about advancing equity. We'll talk about a process that gets you to advancing equity, because getting family engagement and getting family and voice is not just about getting their information. It is also about changing our policies and practices. So I want to be set up to make sure that we're thinking about this in a way that leads to being responsive. And then, of course, Jamie will support us in the end to answer all of your questions. I want you to hear what I'm saying and look for what challenges you're thinking versus confirms what's right. All of us are learners in this. While I've been doing this for a while, I am constantly learning about new people and new populations and new ways of being. Every time I meet a family, it's the first time. And I want us to think and make meaning together. So if I say things that you're curious about or you don't have full understanding, please feel free to put it in the chat. Happy to have a back and forth. And then also believe that we can all do this, especially when we think about family voice and engagement. The first thing people told me when COVID hit is, oh, we can't do that, because we used to go out in community and actually meet with people. We have successfully continued to do that through COVID. And so just like you are participating in the conference this way, there are ways to connect with families virtually and others. We're not going to solve everything today. I'm going to run through lots of ideas and concepts, but I've got about 45 minutes to do that. And so I'm happy to connect at other points. We won't be able to cover everything, and we're really focused on this process around family voice. I always start my talks with having you think about why. Why do you want family voice? Why do you want family engagement? I was in a state just yesterday, and someone said, around moral obligation, and that might be your reason. There may be others. I'm not sure moral obligation is enough to get our boards and our directors and our organizations and our governments behind our work. So here's some why, and these are headlines from articles in Ohio. Life is improving for Ohio children, but not all of them. And I think the earlier presentation reinforced that. Pandemic disparities mirror pre-existing conditions for low-income families, minorities, a report shows. So while we worried about what happened to families during COVID, many of those families were struggling prior to COVID. These 5 charts show the struggle for Blacks in home ownership, again, a long-term issue. Healthcare coverage gaps remain for Ohio's Hispanic kids. This trailblazing suburb has tried for 60 years to tackle race. Why, if trying isn't enough because they're not getting the returns they want? Data shows inequity span from cradle to grave for local Black residents. The pandemic only compounded the childcare woes in welfare. I'm curious about your why. I offered you some categories to begin this conversation. You may have others that you are welcome to put in the chat. But what's your why? Is it about job responsibility or personal experience, a moral responsibility, empathy and compassion, changing demographics, data or current events, or policy mandates? Take a few seconds and you can pick all that apply for you. How we doing, Delaney?
I think we're at 70% participation.
Okay, so we'll give it about 30 seconds and then we'll look at the results. Here we go. Okay, thank you all for participating. And we'll have several of these questions throughout, but lots for empathy and compassion, 92%, changing demographics, 19%, data and current events, 19%, looks like personal experience, 59%, moral responsibility, 54, job responsibility, 54, policy mandates, less so. So again, we need to understand why we're doing this work, because there are lots of hows, there are lots of ways to do the work. There are lots of things that we can co-create with community, but the important thing is for you to explore and think about your how and your why, and to think about that with others. Zip codes and where people live matters, race and place matters. The earlier speaker made that point as well. And so it is important that we're actually connecting with and talking to the children and families and communities that we're intended to benefit, given our roles and given our responsibilities. I love this quote by Leela Watson. She says, if you come to save me, you're wasting your time. But if you've come because somehow your liberation is wrapped up in mine, then let us work together. So I encourage you to be thinking about your why and how it's better for you and better for the world. Frameworks around equity. There are lots to talk about here. There are internal things, and you heard some of those mentioned: bias, privilege, ideas of internalized racism. I focus on the external, interpersonal, our relationships, who we know and who we don't know, our effort to get to know communities and people different than ourselves, institutional policy and practice, and the structures, the policies and the laws and the things that happen between institutions that make it difficult for children and families. And all of these things that impact equity are tied together by who makes the decisions, the power, and economics, what's the flow of the money. We all come to this with multiple identities, a mother of adult children, an African-American woman, an educated woman. All of us come with multiple identities, and we all have a culture and a history that we bring to the conversation. But this is what our work, my work, and the work I'm asking you to join me in is seeking to do. Can we increase opportunities for specific children and adults who are caring for very young children who are in poverty or children of color? Can we intentionally understand and remove barriers to those opportunities so that we get optimal growth and development and well-being for children and families? And can we think about distributing resources in ways that don't exacerbate inequities, but in fact remove inequities? And an example is when we have a grant or we have a service or we have an opportunity, we rush to the places that are structured. They may already have an infrastructure or have a partner because we want to be successful. There's nothing wrong with that. But we have to go to the hard places. We have to go to the places where children and families may have less access, and that often means providing additional resources. And finally, when we think we're doing it, we need to work to make sure that we're really advantaging and not disadvantaging those we are intending to dismantle inequities for. I'm trying to get to equity, which is really the results of policy and practice and programs. Lots of folks talk about diversity. Yes, we want more people at the table and we want their perspectives. And we're better if we include their voice and we include ideas in our organizational culture. But the win is when we really hear what we're learning from families and shift our policies, practices, and programs. So again, I'm going to give you in the last part a process for doing that work, connecting with families so that it influences your policy and your practice. But I want to start making sure you understand that it is a loop. It is not a linear process. It's a stackable set of ideas that happen over and over. And we're not listening. While listening is a critical skill, and we want to be able to listen without acting as a part of the process, we want to be able to be committed to hearing what people are saying and working with others and making change. And so I think there are 5 parts of that process. 1 is really understanding root causes. 2 is around data to plan, decide, and monitor. Definitely taking action, and it's in the middle because I think there are lots of opportunities to take action. Working with people, programs, and structures because it's not about one program or one policy. And using your roles, responsibilities, and influence as leaders and with leadership to be able to make a difference. When I say understanding root causes, race is a social construction. It doesn't have any significance, but it's led to the disenfranchisement of lots of populations. It's led to public housing being built where there are not other resources. It's led to libraries and museums and grocery stores being built in some places and not accessible to others. It's led to segregation of where people live and barriers to opportunities in healthcare and other areas. So there are lots of things we want to understand. Even if we're focused on early learning, even if we're focused on education, we have to understand the situatedness of our families, and we have to listen and partner with others to address a much broader range of issues. Taking action happens at multiple levels. You can learn and understand and manage your own biases, manage your own beliefs, but you also need to work at the interpersonal level to build relationships with people that are outside of your social network and work to really share power and be more inclusive and to work to reduce conflict because often there's a lot of folks using animus to cause conflict between groups. You have it, I don't, those kinds of things. And the real goal is to shift our institutional policies so that we develop and design policies and practices that are fair and offer opportunities and benefit to populations that have been excluded. And, the big win is structural, changing our policies and our practices. But we know that just changing the policy is only the beginning, because that implementation has to be there. And we have to be working together at the structural level to do that. There are lots of opportunities to act. I encourage you to read this article, The Curb Effect, because it talks about this was about creating curb cuts and sidewalks. And it talks about how all of us now use those curb cuts. So even though we went in and we listened to people who had needed the curb cuts to be able to get up, they couldn't get up the hump. But once we did it, it had a ripple effect that benefited anybody who's ever had a stroller or a roller suitcase. And it goes through how important it is to listen to populations, but then how those things benefit a larger society. It is critical that we're thinking about you all as leaders and as working with leadership. So here's the second poll. Do you see yourself as someone with authority, responsibility, or influence to advance actions that increase opportunities and remove barriers, distribute resources differently in order to engage in equity, or monitor and measure? So let's do our second poll. Thank you, Delaney. How are we doing, Delaney?
Pretty good. We're almost at 75%. Oh, we just passed it.
Okay.
I will wait a little bit longer though.
Okay, a few more. Okay, what do we have? Okay, so this is critical because, again, as we seek to listen to families and include their voices, we want to activate our own efficacy. And there are lots of things we can't do, but there are lots of things we can do that are responsive to children and families. I did a workshop once, and someone who was answering the telephone was her role. And after it, she said, I'll be nicer the next time, because that parent who called might have been through a lot before they got to me. So there are big things that can be done and small things that can be done. And it is important that you work to understand where you have responsibility, role, or influence in making it happen. You want to ask yourself in your work, who is and who is not benefiting from policies and programs? And as a leader, what actions can I take to intentionally and consistently include that voice at the table in your work? And do you intentionally try to engage those farthest from opportunity and understanding the data, the quantitative data, the numbers, but also the qualitative data that we're going to talk about you seeking to include in the conversation? There are multiple people and structures that are involved in the lives of young children and families. There are multiple practitioners, there are multiple settings, there are multiple types of organization and multiple policy. And we need all of them, because we can't reduce or address the issues of equity without a single leader. You have to be able to do it and hear it in multiple ways. You have to work with multiple leaders, and each of us brings different expertise, experiences, and resources to the conversation. So we ask you often to start with data, to begin thinking about having data for planning, decision-making, monitoring, and making progress to determine who's benefiting and who's not benefiting, to help you think about root causes and uncover strategies, and of course, monitor in the end. We actually use multiple data sources, because one data point only tells a piece of the story. We often go to the county health rankings or opportunity index. These things help us find the children and families in our states, in our communities, in our counties that are not having the well-being or the outcomes that we want for our families in our state. But we have to look at it from multiple angles in order to fully understand it. And we have to disaggregate it because everybody's not having the same experience. So if you disaggregate by poverty, you disaggregate by race or other factors, even within race and ethnicity, you will find that people are having a different set of experiences. I like the Race for Results Index because it recognizes that the well-being of children is intrinsically connected to their birth, but it's also connected to the adults in their lives. And you can look at communities around what happens on that pathway as children go through, which you also saw earlier today. So in Ohio, all children and all families are not having the same experience if you just look at this Race for Results Index, which has a scale of 1,000. And so some families are at 822 and non-Hispanic, Black or alone at 276. So, and it's based on these earlier factors. So there's a differential experience for those families in your community. So to the work of how do you listen to, how do you bring in the voice of families and communities? So first, again, a poll. How often do you communicate with families, children, or the workforce or community members that are intended to benefit from policies and programs? And in this poll, there'll be a second question that says, do you collect information from families who intended to benefit from families, programs, or policy, but are not currently benefiting? So let's launch that poll and see where we are. How we doing, Delaney?
We've got a little bit more time for people to select some answers.
Okay, good. Because you have to answer both questions. Thank you. Make sure you hit submit. Give it a few more seconds.
And give it a little bit more time and then I will cut it off.
Thank you. Okay. And so people are communicating with children and families intended to benefit. Often 52%, 38% sometimes really want this to be an intentional practice. And it doesn't count when people are coming in for service. You want to be able to step back and reflect and give people a chance to give you broad-based feedback. And then 63% are connecting the families who are not currently benefiting. And this is the number we want to get up and talk to you all about a process where you're doing it in an ongoing way intentionally. So thank you again for doing that poll as well. So our goal is to make children, families, workforce providers. I start with children, I start with families, but often as we begin to do the work and we get some information from families, we start to say, well, what is the perspective of the workforce? Sometimes it's the same, sometimes it's different. Certainly want to be working with providers, early educators and owners, people who work in home visiting and other types of areas. And then often we also get to the community leaders and local policy leaders because many things need to be addressed at many levels. But our goal is to make their voice more visible. Often when, and I consider all of you leaders, wherever you sit in the community, working in a program, you have the power to offer service or advocate or be available. So I'm using the term leaders, and I see all of you in that definition. Leaders are often far from those they intend to benefit, especially if you are in advocacy or at the state level or managing a program. Understanding the lived experiences is a continuous opportunity. It is not something you do once and feel good about it. The farther you remove from service delivery, if you're not doing service delivery, the more narrow the voices may get. You often are driven by your own passion and your own stories, but the story is changing all the time. And many of our children and families are not situated equally. And so we must intentionally listen to them. In addition, our own social networks are often not very diverse. And we do this because we want to move from single stories into multiple stories. We want to not just improve what exists, but we want to understand why that problem is there. And that often means, and you'll hear me say later, bringing a partner to the table, that sometimes making the stone soup, working with others, gets to the root causes and creates greater benefit from your own work. We don't want to just be doing technical assistance. We want to chew on the hard stuff. We want to take on adaptive challenges, which are complex and require us to be curious and require us, again, to be in feedback loops with families and communities. And we don't just want to say, well, if they put a bus system in, we wouldn't have a problem looking out the window. We want to say, well, what is it that we can do? Can I move my office to that community one day a week? Maybe it's one day a month, versus saying it's about the transportation. So how do we look at what we can do? And, everybody's busy, everybody's saying we don't have a lot of time, but I really ask you to find time to listen to the people who are benefiting and not benefiting. They have a lot to say to you that could improve their outcomes. When I talk about beneficiary voice, I'm asking you to meet these 4 goals. One is to listen and understand the goals families have for their own children. We get to be experts, or we get to be professionals, and we have all these ideas about what children and families want and need, and what we should be offering. But we have to enter from the lever of what families' goals are for their children. And they will build goals and change goals over time, but we start there. We've got to develop experiences with populations and groups that are racially different, that are experiencing inequities. We need to understand their experience with our institutions and our structures. And they will tell us if we give them a chance to just listen. And I'm saying just listening over and over and over, because it's so critical that we just sit in the space and listen. And that's hard for many of us as professionals. But our families bring many strengths to us about what they want. Also, families are making it, right? COVID was hard on lots of us, and some of us had resources, and some of us, others did not have as many resources, but they have made it. They've taken care of their children. They've kept them healthy. They've taken care of other family members when they're sick. And in order to add value, we have to understand how that process works as well. But families are really not waiting for us to come and offer them a program or service. They are taking care of their children, their elders, and other people in their families. And we use that information so that we can have ongoing lessons that we can apply to our own practice. So you won't be able to necessarily use the information immediately, but if you create this intentional practice of listening and talking to families, over time, you'll be able to apply and think about what you've learned. We want to do it in a way that creates feedback loops. No community wants us to go out and to just ask them questions. We've been doing that for too long. We need to intentionally seek feedback, but families need to be engaged in the design, the development, the implementation, and the monitoring. So don't do this if you just want to do one focus group. You want to do it in a way where it's ongoing. Now, what does that mean? We could talk about, is that quarterly? Is that every 3 months? Is that twice a year? But if you make a commitment, you show up. We'll talk about working through nonprofits if you're at a state or a regional level, so that families can have that ongoing support and you have a new way in. It's a cycle of improvement over time. Each listening session, you get a deeper, more accurate understanding of what you heard at the last visit. And you go back and you talk about what you heard and what you might do with that to get their feedback. Great example in some work I did where a family said, oh, they won't hire people from our community, and we really need jobs. And labor was there. It was a Head Start program. Early education folks were there, and labor went back and said, oh, we can fix that. We can come out and we can change the policies around training and make sure you're first in line for training. Well, we went back and said that to them. And he said, lady, I've got a whole folder worth of certificates. I've been getting certificates. I've taken every training you've offered, but I can't get the license because of things in my background. And then I don't have the license and I can't get the job. So we would have fixed the wrong problem if we'd only listened once and not gone back. And then again, I encourage you to think about a cross-sector team. This isn't just about early education. This is about health. This is about housing. This is about public safety. So who's in your network that you can do this work with? And how can you think together about things like funding and eligibility and time frames? But also be honest about timelines. No one's expecting anything fixed immediately. Government doesn't always move as fast. Nonprofits can't move without funding coming to them. Often there's certain things that we can do, but there are many things that'll take a longer period of time. What we ask is that we're honest as we have those conversations. So I want you to put in the chat as I continue, just what are your challenges and opportunities for making this a part of your role, responsibilities, and authority, that it's not a special project or not a special grant, but that you're finding opportunities to go out and listen in a regular and ongoing way. I'm just going to go through some of the consult I give as people think about doing visits. And again, we've done this through COVID. We did it prior to COVID in face-to-face ways and have continued to do it post-COVID, in COVID. Before the visit, we ask you to think about a cross-sector team. Libraries and museums are good partners, early learning. It depends on where you sit, but who's a partner that can be in this with you, both to manage your own biases, but also to hear the information, and also to activate, to listen to what is being said. Determine why. We started out with the why, but what do your team members and what do you want to get out of it? This is critical because it has to be shared benefit. You're not asking them to come and listen to families for your purpose only. Spend some time over coffee thinking about, well, what do we both get out of this if we're able to really listen to families? Use the qualitative data to really determine one or more locations where there's low opportunity or marginalized communities. And by marginalized, I mean not included in the programs and services you're working on. I used to say, come up with a list of 10, but it could be 15. The truth is you can only start in 2 or 3, but have a way to think about it. Don't go to the places where you already know people. You're not trying to build on the social network you have. You're trying to expand the social network you have. So the best places are the ones where you go, I don't know anybody there. I don't know a nonprofit there. I don't know families there. Families don't enroll in our service from there. That's where we should start to listen. Go to the hard places. I say find a local partner. That has multiple benefits. One is that it gives you an opportunity to go back and check in, let people know what you're doing, how you're working through. But it also, if families share things in these sessions that do need immediate follow-up, you're not the doer. That local partner who's got that relationship can do that follow-up. And then co-design the site visit with a local partner. They may have something that they want to get out of it. And then only have 6 to 8 questions. My rule is if you're on site, you're there no longer than 90 minutes. And if you're on Zoom, it's really 30 minutes, but call it 45 to let people come late and get out. You're always going to have another question, but you want to respect people's time. And remember, you're committed to going back. You want to listen. This is the hardest part. So lean in and actually to take quotes, not notes from this. I say this because when you go and talk to the next person, if you've written your notes, you haven't written the things that you already knew or you already understood or you thought were already in place. If you take quotes, you're taking exactly what those families said to the next group, and then the next group can interpret. You can organize the quotes around themes, but the next group that you're sharing the information with, where you're trying to get change, will be able to support you in thinking through how to respond. Here's my, 60 to 90 minutes, 45 to 60 maximum virtual. You always have more questions, trust me, but we don't have to answer them all at one time. After the visit, whoever your partner are or partners are, get your reactions to the visit, but discuss a responsive strategy. Sit down with everybody's quotes and think about who is missing at the table based on what you heard. Put the quotes into a set of themes so that you can think about, well, who's responsible? What agency, what department, what leader do you know that can help on this? It's okay with families and communities when you go back and say, that's not in my lane, but let me introduce you to this person who's really responsible for that. Share the results with other key stakeholders. You'd be surprised how many people are not leaning in to just listening. People feel like they don't have the time or the space, or they have a small group they listen to all the time, and what you bring in may be different. And then you got to plan to get back to that local partner, share what you've heard, share your potential responses, and then go back to the community. And that may not be the same group. It actually may be a different group when you go back. That's okay. But you also may get a couple of people who come back for the second time. We also stipend families, and we stipend the host agency. So if that's possible, our time is being paid for. It is critical that we're respecting the time from families, and we're offering them a stipend. We usually do a gift card to support families' participation, and then a small stipend to the organization for organizing and getting the families together. So that's the process. Here's the importance of the protocol. I usually, again, say 6 to 8 questions. This is a first visit kind of protocol. They're all a little bit different. Remember, I asked you to co-create them. But what I want you to see here is I'm not asking how is early education and care, or do you have child care? I have used the social determinants of health, where you ask a question in each of those areas. But this one is one we use recently in a state. And through these questions, tell me about your children and families. How are they doing? What's important for you right now? What are you worried about? What's working? What's not working? Are there things other communities have that you don't have? How do you get information? And if you had the magic wand, what would you do to help children and families? So this protocol is designed to give you a range of conversation. If you're on virtual, it's okay to be with 2 families or 5. It's important to keep it probably around 8. You don't want to not be able to see all the squares and boxes on the screen. So I offer you this as a way to think about how to get information from families. But from this, I heard about mental health, I heard about working, I heard about childcare, I heard about healthcare. So if you give families a chance to talk, they'll tell you what's important. These are some quotes from multiple conversations with families that we've heard. She's underweight and I've been fighting for 5 years. So sometimes the things we think are working are not really working. I get job offers, but I don't have childcare that works. The system is not designed to support me to be self-sufficient for my daughter. I don't think we give our single parents credit for how strong they are, and when they don't know where dinner is coming from. Did some work with families around websites, and they said one of the things that was most irritating is the website tells you what to do next, and it never says, thank you for finding me. I know you're working hard to do good things for your child and family. Here's something else you might consider. That websites often come in and tell you what else you need to do versus recognizing that you've already done a lot to even get there. How do you go back to school when you need to work 3 jobs, rent, and can't afford child care? I've been denied twice by the county for food and cash support, even though I qualify. What's going on in the front line there? We are all just looking for answers, not handouts. We want solutions. Systems don't look at the full family. Just did some work in Ohio where this issue of whole family came up. We have so many services that are for the adult or for the child or for the mom and child, and we're not including fathers. That so often we talk so much to the family that a family said that the mother is so burdened that she's got to listen to it all, take it home, get him to process it, do the things for the child. So how are we working to look at the whole family? We are not pitiful. We are powerful and resilient. the more you try to get help, the more they try to confuse you with double talk. They need sensitivity training. Well, who is she engaged with? What are the services? What do we need to understand? Now, the workforce has its story too, and we need to be working there as well. Customer service is bad. One example that I learned in a state was when a agency was giving bad customer service. And what we discovered was they had stopped having one worker assigned to the family and used the basket method. So whoever came in, got that form, they worked with that family. And then the next day you come back, somebody else might get the form. And what was happening was the worker was only telling them the next thing that was wrong because it didn't have a relationship. So that was a systemic thing that actually could be fixed. Families were experiencing it as bad customer services. So as you take on this work, and especially as you listen to families, and especially as you work with people who are excluded from the system, and you work to try to bring other people into the conversation so you can solve it, there are 4 things that you're going to hear. One is that people have equal opportunity, and that's just minimizing the idea that there are differences in the situatedness. Is denying the existence of ongoing racial disparities. The second thing you're going to hear is personal responsibility. This is just blaming individuals and not looking at the barriers and the systems that they're coming in contact with. The third is you're going to hear that it's a preference. Well, you get preference if you got privilege, but folks without privilege that are experiencing other barriers are not able to have the same level of preference. And the other is meritocracy. Well, when you get your degree, when you get a better job, you'll earn it. And these are ideas that the playing field is level and there's equality, and that's not true. I'm warning you about this because I hope you join this journey with me to take the message of families and bring it back to your agencies and to your task force and your work groups and your other places, but you will get pushback, and it's usually on some of these themes. So in closing, this work requires a deep commitment, your ability to communicate with your team and others. We need to recognize that there are things in us, and that first part of just listening is one of the first things, and there are things out there. That building relationships and sustaining them with families and organizations and communities is critical. And that we got to practice. We won't get it right the first time, but we need to learn from our failing forward. There are lots of tools that we can use. Our goal is to really open the boundaries, to include people in the conversations that hadn't been included, and to build networks. So with that, I encourage you to move out of your comfort zone, lean into families. It's really a place to grow. Some of the things you think are working actually are not working. And we need to hear that directly from families and get out of a mindset of we don't have enough resources or we don't have enough time, because if the people receiving the services are not having a benefit, we should be doing something else. And I believe many of us have the power. In fact, all of us have the power, from the person answering the telephone to the person who's actually writing the policy about how long you could get a waiver. We each have a level of power and influence in making a change. So with that, Jamie's going to tell me if you've got any questions. I think we're right.
I am. Thank you so much, Dr. Killins Stewart. I love the description of just how personally empowered we each are, and how that contrasted with the poll results on folks feeling like they often, sometimes, or never have the ability to make a difference. And you're right, we always have some small ability to do that. So I have one question here waiting. I'm going to encourage our participants. We've got a lot of people on the webinar. Please think up some questions and add them to the box. I have several, but you all don't want to hear me go on with my questions for too long. So let's start with Tony. She wants to know, how do you standardize or decide on stipends for the host organization and for families? Do you also provide childcare, food, or other things to make it easier for families to join?
Absolutely, all of those things. Yes, if you're doing face-to-face, A meal, if I'm in the American Indian or Native American community, you can't start without a meal because that's a part of their culture. That's a way of joining. I think that's true though for lots of families. We want to do something at 5:30. We want to make sure that there's dinner. If you could do childcare and in safe ways, then that of course is something else that you want to do when we go back to face. Regarding stipends, you need to look at what else is going on. So I try to say if they can't buy their whole family a nice dinner, then the stipend's not enough, which means $25 is usually not enough. So that's my rule, but I get the privilege most of the time of making that decision. And I make sure that I offer something greater to families. I have, though, run into the case where there are organizations that also give out stipends for other reasons, and you don't want to bust the curve. So this is one of the things you negotiate with your partner. Do you give stipends? If you give stipends, how much have you given before? If I gave this much as a stipend, would it cause a problem for you and your organization? And the stipend to the organization is really just a token, $200 or so, sometimes a little more, maybe 50 less, but it's just to say thank you because we realize that organizing for us isn't necessarily a part of their job either. And we want them to be committed to the process over the long haul.
Thank you. So this one was not a question per se in the Q&A box, but I did notice it earlier in the chat box. It comes from Hadley Bachman. She said, I appreciate you shifting the conversation away from the deficits of families and reminding us what a wealth of knowledge families have, no matter their background. So I just wanted to call that out and also ask if you have thoughts about ways in which we can all shift more toward a strengths-based perspective and away from deficit thinking.
Well, I think that's that first question. And that's why I say you only get 6 to 8 questions, because it's not about what's not working. It's about what's working and what else they want to work better. So if you start with what families' goals are for their children, then you're starting there. I'll give you an example. In some museum and library work that I do, we encourage museums, libraries to work together, same data process, go to a community that's not showing up at the museum or library. And they did that. And they went out and they went to the place where the families live, because we also want to do that. We're not asking people to come to state capitol. We're getting in our car and driving 3 hours. I've driven 5 hours, or flying to another part of the state. That shouldn't be hard for us. If it's hard for us, it's even harder for the families. And so they went to that place and they started delivering books. That was just a book library where the children and families could take the books. And then when she went back the second or third time, the kids started asking for specific book titles. And the museum was giving out free passes saying, come on to the museum, come on to the museum. A year later, one of the moms came up and said, book lady, book lady, book lady, I went to the museum. It takes time to build trust and build those relationships, and for families to work from their sense of importance. And so I think when you're listening, so you're not going in the deficit, you're taking whatever story they tell you, you're writing down quotes. I think that gets to more strength because you hear the story from their perspective and you're not going into your either clinical mind or educational mind to try to interpret in the moment. I'm asking you to listen, take the quotes away, process with the group, and then go back and say, these are the kind of themes that we heard. So I think all those things lead to having a better strengths-based conversation.
Thank you. That is something I've never considered. And so I appreciate that idea of not taking notation on what someone else is saying and like putting your own spin on that voice. So the idea of keeping the quotes, that's something I'm gonna try to incorporate. We still have room for questions. I'm going to ask one of my own. As you were describing the importance of bringing different voices to the table, truly authentically listening about what it is that they want, it struck me that this may often result in program administrators or policy leaders realizing they're wrong, or not even wrong so much as needing to adjust course. Their ideas or plans maybe were off target. But that does not seem like a quality or a trait that is common or prized. Even just in the pandemic, we see the willingness to change data and change course being really criticized and hard for public folks to do. So can you speak to how we can create environments where that type of adaptability is embedded and normalized and valued more than it, I would say, currently is.
It is an adaptive leadership skill. I think what I've found to be most productive is taking those very leaders on these visits when I could visit, when we could do visits or when we're talking to families, having those leaders hear the firsthand stories and hear the quotes does change their stands. Because if we think we're giving grants and that's our job and it's going to the community and everybody's good, and then we hear, no, we went there and they threw my paper away or they've got a process that doesn't work, we're critical of ourselves. So I think it's a process, but it is about adaptive leadership. I think sharing the wins is important, but really including them in the listening. Like, we shouldn't have the community organizer listening. The community organizer should be creating the process so that we all listen, whether that's through videotape clips or doing them on Zoom or creating opportunities to go out. I think that's been a part of the challenge, because you can reject it, the emotional, when we get back on the bus after some of these visits and I've taken 10, 12 state leaders out on a bus, they are impacted by what they hear because they want to believe what they're offering is making a difference and not happy when it's not.
That makes sense. Thank you.
And one other thing I'd say, doing it in groups matters. I keep saying cross sector, because one person has to step out and then it's a risk. But if you're stepping out with health and early learning and there's no immediate thing to do, so also it's not good to do it in an immediacy. You got to have this muscle built so that you're always having these lessons so that you can use it when the next grant comes up. I think it's tough when the grant comes up is due in 6 weeks and we want to run out into the community and get all the messages, that is less effective.
Are there any data points you think we are overlooking or not capturing? You want to charge the folks in the call, the 60 some of us here, to think more about?
Data points in terms of families or what we're learning from families?
Yeah, qualitative or otherwise. You've described kind of that more inclusive process.
I think most of us are missing all of the qualitative. I think that we're writing too much. Now remember, who writes the test or who writes the study determines what the question is. And so we are using a very narrow set of people to decide. So I think we've got to include families, even when we're doing surveys that are going to give us numeric data. We need to see, well, what do they want to know? Or what are they interested in sharing? Or what is important to them? So I think there are lots of data points we're missing. I don't have a list, but I know that if I include families, they have another set of questions. So one example is often in TANF. The goal is to get people off of TANF, to get them in a job and have them be self-sustaining. But the data point we're missing is the job they want. I have a story from a family who said that she went, every time she had to recertify and they say, are you working? She said, yes, and I hate it. And every time she went, she said, yes, and I hate the job. And a new opportunity came up to really think about whole family, whole community. She said that to a worker. She said, oh, so what would you like to do instead? And 2 years later, she has her GED, she's shadowed on a job, and she's in a different kind of job. So I think there are lots of data points we miss by not listening to families and by letting research really be driven by previous questions and previous ways of thinking about how we think about and measure success. So what is success for a family that has a rough spot and ends up needing some economic support? Or what does it mean for our society that we have a whole set of low wage jobs and therefore we force people to need the kind of support? So what do they want? What works for them?
Absolutely. Early in the presentation, you pointed out how a key part of ensuring racial and economic equity for young children is about better opportunities for the people who care for them. So I know a lot of folks in our audience think about this a lot, carry this around. We know those caring for young children are historically underpaid and undervalued. And there is this discrepancy between how we sort of talk about valuing educators and early educators. We say it, but we don't put our money where our mouth is. So this is taking in a little different direction, but from just a policy point of view, if you had a magic policy solution wand, what is the next best step to increase opportunities for those that are caring for our youngest children, especially children of color?
you know, I'm riffing here, but we've got to pay people a living wage. I don't care what you make the marker. Nobody, and I'm not saying I don't, and this is not popular, but if you never got another credit, you should get paid a living wage. We should not have jobs in our country that don't allow you to take care of your family. So one policy is right now, while we have the opportunity of resources, let's get everybody into a wage where they don't need subsidized childcare, or they don't need SNAP, or they don't need WIC. Let's do that. And then through that, people will do the other things that we're asking around education, around the things that make them stronger in their roles. But it's hard. If you saw the quote, I got to work 3 jobs and you want me to go to school. How many early educators are leaving one job and going to another job? And then we want them to go to school. And we need to recognize, this is a systemic piece, that going to school is not a piece of cake. Any of us who've done it, or most of us who've done it, don't always have a pretty story to tell from A to B. It wasn't easy to get all of those credits for my bachelor's degree, and then my master's, and then my doctorate. There were many, you know, difficult times along that pathway. So we act like this entree into higher ed is paved with gold, and it's really not. So we've got to work with our partners there, you know, maintain their intellectual credibility, but also make it accessible for adults so that we're getting the kinds of things that matter, and that it is done in a way that respects adults. Even in higher ed, all the departments you have to go to, you know, when you're 16 or 17 and they say, go to the building on this street to do this, and go to the building on that street to do this, and go to the building over there to do that, you like work it out. But when you've got 3 kids and you're trying to go to school after work and that building closes at 5 o'clock, you can't even get the administrative part of going to school to work. And there are life strategies trying to work towards this, but it does go back to the system. So one, you pay everybody a living wage. And I think right now we have the opportunity. I think the second is we got to reduce class sizes. We learned in COVID, it's good for kids, it's good for teachers to have that group. Most people are not talking about that, but we need to reduce the class sizes. They're smaller now because people aren't coming back. Why aren't we calling that a win? Let's call that a win and talk about what it takes to fund it. It's good for teachers to be able to individually focus on folks, and it's good for the kids to get that individualized support and instruction.
Thank you. Yes, the chat box is lighting up. Yes. Lots of claps. Someone saying, I've been fighting for this for 40 years. Thank you for joining us.
Now's the time.
Fighting.
But we can do it now. This is the individual efficacy of all of us as leaders, though. So who do we need to get that message to so that we call the question on that? And there are programs that do it. So it's not foreign. You know, there are programs that raise a lot of funds on the side, and they have a 3rd teacher in the classroom, which helps with relationships, which reduces the ratio. So this isn't a foreign idea. It's just a privileged idea. Most people get to do it, come from a place of privilege.
Yes, thank you so much, Dr. Sherri Killins Stewart. We are almost up to the 2:30 mark. I want to thank all the participants for your amazing conversation and just the affirmation. I think that this is absolutely worth championing, and the work can't stop. You're going to see a survey come up here soon, and the 2:30 remarks will start with Dr. Barbara Boone. I encourage you to stay on for that closing. She's going to wrap us all up and try to have an application for all that we've heard today. No easy task. And I just want to thank you again, Sherri.
Thank you.
And everyone else giving a virtual round of applause.
Thank you, thank you, thank you. All right, talk to you soon.
Thank you.